Well, I want to welcome everyone to the Dayton VA Medical Center's Eligibility and Enrollment webinar. We are thrilled to be here with you tonight. I want to start by saying this event is being recorded, so if there's something you miss or later want to rewatch, you'll be able to do that. We will be sending you a link to the recording after this event. You can also share that link with anyone you feel may benefit from the information we're about to share here tonight. I'm Scott Leese with the Community Outreach Office at the Medical Center. I'm an Air Force veteran, and like many of you, I actually once had many questions about VA healthcare. Let's see if we can answer your questions here tonight, especially those about eligibility, enrollment, and healthcare through the VA. Please realize that as a participant in this session, your microphone has been muted to minimize distracting background noises. We have quite a few participants on this webinar this evening, which is why we're keeping everyone muted. Again, this is simply to ensure that there isn't an excess of distracted noises. That doesn't mean we don't want to hear from you. If you have a question or a concern, you can share it with the panelists anytime through the chat pane, and you can find that at the bottom right of the screen. Simply type in your question, and the presenter will get to you as soon as they can. For the sake of time, if we don't get to your question during this presentation, you can reach us by phone or email, and we'll provide that contact information at the end of this presentation. So you will be able to give us some more feedback if you like. While we have a long history of veteran care here in Dayton, this year actually marks the 76th anniversary of our Modern Veterans Administration. The campus has been around here since the late 1800s, but the VA is new, modern, and going strong with state-of-the-art medical center here. We're very proud of that, not only to be one of the oldest campuses, but also boast the newest and most modern facilities offering top quality care. Not very many people know about the VA or that it's recognized, according to a study done by RAND, as being one of the top medical care systems in the nation. And it's also top rated by the veterans who it serves, with a more than 98% satisfaction rating by those veterans. This is a benefit that not everyone is able to receive. This is only available to veterans. So I'm going to ask, wouldn't you like to have that kind of care, the kind of care that your peers really admire and appreciate? Well, that's the reason we're here tonight. We're going to talk about VA healthcare. Before we take your questions, here's someone who can tell us a little bit more about how you can enroll to receive this quality care. Bill Pagilek is here with us this evening. He is the Support Services Supervisor in our Eligibility Enrollment Office, and he's going to give you a brief presentation that goes into more detail about eligibility and enrollment with the VA. Bill?
Thank you, Scott. I'm Bill Pagilak. As Scott said, I'm the Support Services Supervisor here at the Dayton VA Medical Center. And we'll just briefly touch on the agenda and begin. So we'll talk about some common terms that are used for eligibility enrollment, who is considered a veteran, character of discharge, criteria VA uses to determine eligibility, and other eligibility factors. All right, so for reference, the Bible, if you will, for VHA eligibility and enrollment purposes, the directive that we refer to is 1601A.02, and we use this to reference for all of our eligibility determinations. All right, so let's touch on some common enrollment terms. What's registration? Well, registration is slightly different than enrollment. We think that they're synonymous, but it's adding a veteran or patient into the enrollment software, which is the VA's electronic health record. Enrollment is the acceptance of an eligible veteran into the VA healthcare system and assignment to a priority group. Ineligible is a veteran determined to be ineligible for enrollment. Rejected is income exceeds VA national or geographically adjusted income threshold. I hear that they're going to be changing that terminology to deferred in a couple months. And then service connected, you'll see it abbreviated as SC a lot. A veteran who has an illness or injury incurred or aggravated by military service as determined by the Veterans Benefits Administration, VA Regional Office. And it's important to note that veterans are not charged for any condition or illness related to military service. neither should their insurance be billed. Okay, some more terms here. Compensable, monetary benefits related to a service-related illness, disease, or injury that can be compensated. Non-compensable is not in receipt of monetary benefits from VA for a disease, illness, or injury related to a military service. NSC, or non-service connected, is a veteran who has been discharged from active military duty and does not have a VA adjudicated illness or injury incurred or aggravated by military service. And a NSC pension is a veteran's pension that is a tax-free monetary benefit payable to low-income wartime vets. Okay, so let's start off here. Who is considered eligible for health care? A veteran meets basic eligibility requirements for VA health care if they meet the following. The first is minimum duty requirement. So it's important to note that 1 day of active duty service for the following, those that were enlisted on or before September the 7th, 1980, or officers on or before October the 16th of 1981. After that, there's a requirement of 24 months of active duty service for the following. Those that were enlisted after September the 7th of 1980, or officers after October the 16th, 1981. Reservists or National Guard members activated under a Title 10 executive order for any period and completed the period they were called up to serve also fall within the eligibility criteria. Okay, so we're also looking at character of discharge requirement, whether or not they're honorable or under honorable conditions that are characteristic of their discharge. So there are some exceptions to minimum duty requirements in accordance with 38 USC, specifically 5303A. Minimum active duty requirements do not apply to persons discharged or released from active duty for early out. Those are enlisted only. That information can be found on your DD 214. Those that are enduring a hardship, discharge due to a disability that was incurred or aggravated in line of duty. That goes hand in hand with veterans with compensable service-connected disabilities. Those that were also contracted for a 15-month enlistment, you'll see National Call to Service on the DD 214. The narrative will state completion of required active duty service or expiration term of service, ETS. Sometimes it'll just have the acronym and nothing else. Active duty for training, 0% service connected, non-compensable National Guard reservists are the exceptions to the minimum duty requirements as well. Next slide, please. Okay, so we mentioned the character of discharge. So for enrollment, the character of discharge must be honorable, honorable for VA purposes adjudicated, which will be abbreviated HVA, or under honorable conditions, UHC. Okay, so if the character of discharge is one of the following, which I mentioned other than honorable, uncharacterized discharge, or bad conduct discharge, these don't necessarily mean that you aren't eligible for VHA care, but they must be reviewed by the VBA, the Veterans Benefits Administration. And veterans may apply for VHA healthcare, but their records will remain in a pending or registration only status until the VBA can make a determination, which will be one of the following that I list here. One, that the character of service is determined to be dishonorable for VA gratuitous purposes, DVA. However, the former service member is entitled to health care benefits under Chapter 17, Title 38 USC for any disabilities for this period of service. Or the character of service is determined to be dishonorable for all VA purposes, DVA, due to a statutory bar. The former service member will not be entitled to health care benefits under Chapter 17, Title 38 for any disabilities for this period, 12D and 12C respectively. Okay, so this is what you will see if you're determined to be ineligible. It's typically if the character of discharge is dishonorable, but it can also be dishonorable for VA purposes adjudicated. The ineligible duty requirements, you'll have a reason that is stated. If you did not have 24 months of active duty after 9/17/1980, if you didn't have 1 day of active duty service enlisted prior to 9/7/1980, if you were a reservist or National Guard member that never activated under Title 10, or you were Title 32 for national emergency or civil disturbance, that that is you were deployed, so to speak, but you weren't under Title 10. In certain cases, you will have a tentative eligibility, which means that you can potentially receive VHA healthcare, but only for emergencies or based off of some sort of temporary military discharge status. Okay, so tentative eligibility, which I just stated, if you fall under this corner case special scenario, you will have to sign a VA Form 119, which is a report of contact, and that's agreeing to pay services if you are found ineligible. So if you, the applicant, have been determined to be ineligible for enrollment, then you will be provided a humanitarian emergency care form, but only until your condition has stabilized and you can be safely transferred to a community health care facility external to the VA.
Okay, Bill, thank you so much for that very informative presentation. As most of you can probably see, it's a little complicated sometimes when we're talking about eligibility through VA healthcare system. But again, that's why we're here tonight, is to talk about that and answer your questions. We've received a couple already in the chat pane. I want to again remind everybody that this event is being recorded. We've had several people actually log in since the beginning of the presentation. So I just want to let everyone know that you are muted to limit distracting background noises. Again, that's not so we can't hear from you. We want you to actually ask questions. By all means, please type them in the chat pane at the bottom of your screen. We will get to them as quickly as we can, but I just want to make sure that everybody is aware that we are recording, and we will be sending out a link. So if you want to rewatch this, you can. Also, we'll also give you some contact information if there's something you don't want to ask here in this forum, so that you can reach out to us privately and ask those questions. Again, I am your host, Scott Leese. I'm with the Medical Centers Community Outreach Office. I am an Air Force veteran and will help answer any questions you might have about the Dayton VA Medical Center in general. Bill is our subject matter expert for eligibility and enrollment. Please remember, again, if you have any questions, type them in the chat pane. We'll get to them as soon as we can. If we don't get to your question tonight, please know we still want to answer it. We will give you a way to contact us at the end of this presentation, or we also will have the information in the chat pane, and we'll be reaching out if we can't get to you before the evening, because we do have quite a few people on here tonight. Our first question is, Mary is asking, is there a VA enrollment period like you'd find with a company's health insurance?
So that's a good question, Mary. So typically, no, there's not an open enrollment period. You're not going to be penalized. VHA healthcare is a benefit for you and not an insurance. So there's no true statute of limitations on when you can apply. However, if you know that you're a combat veteran and you've recently discharged from the military, we want to try to get you at least into priority group 6 as a combat status veteran right away. Also, if you're dealing with certain service connection conditions, then we want to try to get you in ASAP. But no, there's no timeline on when you need to approach us.
So that actually brings up a great point, Bill. You talked about a category that veterans are put in categories, and there are 8 different categories, if I'm correct. Is that right?
Yes, sir.
And those categories are based on your service of when you served, where you served, also your service-connected disability rating, and several other factors, which determine how much care you receive from the VA and whether or not it is at a free of cost or a copay, correct?
Yes, and
Is there
depending
anything else you'd add
depending
to that?
um yeah, so I mean you pretty much hit it on the head there, but yeah, priority groups are 1 through 8, and depending on a lot of things such as uh where you served, if you had a service connection, if you don't have any service connections, they also look at your income, and there's a national income threshold, and depending on a mix of any of those things, you will receive either priority group 1 through 8. And I think the most important thing to touch on is depending on your priority group and also depending on your income, your co-pays can be slightly different depending on what either your income or your priority group is. It
Slightly
is
different or non-existent?
exactly, exactly. It's a little complicated, but we encourage you to come in so that we can walk you through it because everybody's case is different.
It is the government, and all of us are veterans here, so we all know that it's never simple, right? There's going to be complications. Brian wants to know what disqualifies someone from receiving VA benefits, and I'm assuming he's talking specifically about VHA or Veterans Health Administration benefits.
Okay, so what we touched on in the slides earlier, um, so the first thing that could potentially disqualify you is if you have some sort of other than honorable or dishonorable discharge from the military. But I want to preface that by telling you that if you do have that, if that is the case, don't let that discourage you from coming in, asking questions, calling us, and trying to investigate it further. Because generally, in order to receive VA benefits and services, the veteran's character of discharge or service, it must be other than dishonorable conditions. So honorable, under honorable, or general. However, individuals receiving undesirable or bad conduct or other types of dishonorable discharges, you may still qualify for VA benefits depending on a determination made by the VA. So that's like what I touched on earlier, where you could potentially be adjudicated through the VBA and certain structures to where even though you were dishonorable, you could still be seen potentially for VHA purposes. Additionally, if there's something that you question on your DD 214, each of the military services maintains a discharge review board with authority to change, correct, or modify discharges or dismissals not issued by a sentence of a general court martial. So if anybody's interested, we can eventually put that in the chat too. There is a VA upgrade wizard where you can learn how to apply for a discharge upgrade if you are interested in that as well.
All right, thank you. Joe is asking, once enrolled, am I always enrolled in VA healthcare?
Okay, that is an interesting question. So, um, yes, you are technically always enrolled once you are enrolled. However, depending on those priority groups that we talked about earlier, the 1 through 8, the ones that qualify that do not have any service-connected conditions that are just under the income thresholds where they qualify for VHA healthcare, you will have to report income through a means test yearly in order to maintain your priority group. So you you can receive health care, you can receive benefits. However, there is just certain paperwork since it's the government and there's always paperwork involved that you will have to continuously report so that we can keep track of that for VHA purposes. And that also serves to benefit you because if your income fluctuates where you lost a job or your dependent retired or for any number of reasons, if your income can fluctuate from year to year, so that can also change your priority group.
In your favor.
Yes.
Yes. So if you're making less money all of a sudden, then that puts you in a higher priority group. Additionally, I think I might add that while it's not so much a matter of determining eligibility, once you're registered, you're in the system, you have to maintain your enrollment by actually utilizing the VA too, correct? Bill, that if you don't use your VA benefits within so many, I believe it's 3 years, if you don't go see your primary care physician, then you are no longer an active enrollee, correct?
That is correct, and you'll kind of be placed in a suspense. However, there's there's other things that you can do to maintain that. You don't just have to go to your primary care doctor. You can go to another doctor that could be a specialist here. It can be something as simple as changing your medications too. So just as long as you're active in the system.
Great. Joy is asking, I've been told I make too much money to qualify. Should I still apply for benefits?
Absolutely. So that kind of goes hand in hand with what we were talking about earlier. So, um, you could potentially have a service-connected condition, and uh, if it is, it could potentially even be compensable, but you will have to file a claim through the VBA. If it's determined that you do, whether it's 0% or higher, you will receive a priority group, regardless of what your income is. So even if you do make a lot of money, you can still potentially be seen here based off of your service-connected conditions. Also, important to note, just like how I mentioned, I'll reiterate it again, but your income can fluctuate from year to year. And also, if you review the 1010EZ, which is the application for enrollment, there are certain things that might not technically be included as income. So even if you made a lot this year, if you had a lot of documented medical expenses, you do not have to report that, or that is taken off the top of your total income because it was proven medical expenses that you incurred. So that could potentially put you under the threshold and therefore make you eligible even if somebody told you that you technically make too much money.
Okay. Ken is asking, does the VA have a health card and what makes him eligible to receive one?
Yes, we do have a health card. It is called the VIC card, and that is a Veteran Health Identification Card. That is a member ID that we use here for the VA for identification purposes and check-in. Uh, the VIC cards are not mandatory to receive VA healthcare services, but they are an identification card that has your picture, your name, if you choose to do so, or if you have one, your service connected uh, status, and also if you choose, it's optional to list what branch of the military you came from on that card. The card, it has in the member ID a barcode and a magnetic strip on the back that's read by software applications to look up your record upon check-in. If you're recently retired, you might have had something called a CAC card. Once you retire, if you're interested in the VIC card, you can come to the eligibility enrollment officers at the Maroon desk here at Dayton, and we can get your picture taken. And as long as we have a legal photo ID to verify who you are and that you are currently enrolled in the system, we can get that mailed out to you within 2 to 3 weeks.
Great, thanks. Greg is asking a question that I hear all the time in public affairs being out in the field. Talking to veterans are asking, if I move, do I have to re-enroll if I transfer to another VA in a different state?
Okay, that's a great question. So, veterans who choose to enroll in the VA healthcare system, they're enrolled once, and they may seek care at any VA facility without being required or requested to reestablish eligibility for VA healthcare enrollment purposes. So what that means is you may request a change of your preferred facility at any time by contacting the Health Eligibility Center, and asking for an enrollment case manager. Or what I suggest is the easier option. If you're at Dayton VA, come to the Maroon desk. If you enter the front entrance and you take a left, you walk down the hallway, the Maroon desk between 8 a.m. and 4 p.m. Monday through Friday. Just ask one of our MSAs or our enrollment and eligibility specialists, ask them to update your preferred care facility, and we will update that through our software as long as we can verify who you are, and we can honor that request immediately.
All right, super. Mike wants to know, does having insurance affect my VA benefits, specifically Medicare?
So no, having insurance allows the VA to bill your outside insurance for the copays you may incur for your visit, but for Medicare, since that is also a government insurance, the VA will not bill another government insurance for fees.
Okay. Ted wants to know, why does my income need to be reported for VA purposes?
Okay, so again, we touched on this earlier. Our office needs to know your income to see if you're eligible for care, and that's specifically if you do not have a service connection disability from the military.
Okay. Rhonda wants to know, what are copays?
Great question, Rhonda. So, copayment or copay is a fixed amount for a covered service paid by a patient, and depending on your priority group, it could be variable. So I can't give anybody a solid blanket copay right off the bat because that is determined on a case by case basis.
Okay. Bill wants to know, can my spouse be seen at the VA?
Okay, so it's kind of a gray area, but predominantly no. Only veterans can be eligible to be seen at the VA. But if you are a 100% service-connected veteran, spouses can be accepted with Champ VA, and their number is 1-800-698-2411. And if you have any questions pertaining to Champ VA, if you are Priority Group 1, 100% service connected, the helpline for Champ VA is 800-733-8387, and they're available 8 a.m. to 7:30 p.m. Eastern Time, Monday through Friday. If you call their customer call center with the name of an insurance company, type of policy, or the effective date of your policy, or you can mail them at Champ VA, P.O. Box 469063, Denver, Colorado 80246 for Champ VA questions. Dayton, unfortunately, isn't a Champ VA site, so you can still potentially get care. You'll just have to contact the helpline on how to coordinate that care outside of the VA Medical Center here at Dayton.
Okay. Again, I want to remind everyone, if you have a question, you want to ask it here in the open forum, you can type that question to the chat pane. We'll get to it as soon as we can. Next up, we have a question from Elizabeth. She wants to know, what are the financial requirements?
What are the financial requirements for?
I believe it's for, are there financial requirements for capping for VHA healthcare?
Okay, so
No. And I know that's not an easy question to answer. There's no pat answer for that.
well, give me a second because the thresholds actually do change year to year, and I have that I had that pulled up, but I will have to pull it up again to more thoroughly answer your
While
question.
you're looking for that, I would also tell everyone that for some of these questions that we can't give you specific details on, it is going to, you're going to get some information on how to contact the folks in eligibility and enrollment. You can call them, and sometimes these questions have to be answered based on the veterans themselves and their history and needs and military
Yeah.
background and so forth. So that
So
is going to be a moving target.
Yes, you're absolutely right, and that's why I had to pull it up. So I apologize for the delay there, but right now for the calendar year 2023, it's always based off of the income year prior. So we're looking at income year 2022 here, okay? And if you don't have any dependents, the national threshold that you need to be at or under is $39,849 for Dayton. However, there's also a geographic means test threshold that we look at too. So the easiest way I can kind of compare this is there's a blanket number that you're supposed to hit or be under in order to qualify just on income and veteran status alone. However, if you do happen to be under that, there are certain cases depending on where your place of residence is, your geographical location, to where we're looking at another number too. So for Dayton, the geographic means test threshold for 2022, this year right now, is $41,150 a year. So um, if you would be between the $47,150 and you had the Dayton address, but you were above the means test threshold of the 39,849, you could potentially be placed in priority group 7, which means that you are still eligible to receive care here. However, you have to pay copays on almost everything. So, depending on your place of residence and depending on a lot of factors, that's why it's important that you fill out that 1010EZ application for enrollment to the best of your ability to completion, and one of our staff members can walk you through it and show you uh, what you are eligible for and what priority group you fall under once we get you registered.
Right. And I think it's worth stating again that it's not just financial requirement. If you have a service-connected disability rating, suddenly that's not so important anymore because you are in a higher priority group right then and there. And I think we should probably say that if you aren't if you don't have a service-connected disability rating, you think you might be eligible for that, or just want to know more about that, we're going to encourage you to contact your county veteran services office, who actually can help with that process. They can actually counsel you on how to get a disability rating and help you through that process. So I want to emphasize that too, that a lot of people hear the financial numbers and think, oh, I don't qualify. Well, again, this is a very complicated process, and there isn't just one particular um, qualifier here. So please reach out to us individually if you really have some questions or concerns. Rodney is saying, I have a 10% disability that I get paid for monthly. I'm pretty sure that I'm enrolled in the healthcare. My question is, uh, that if I go to the VA when I am sick and it doesn't apply to my disability, how much do I pay?
So I can't tell you that offhand because just because you have a service connected disability, I can't know off the top of my head if what your priority group is right now because it's not just your service connection that affects that priority group, Rodney. So what I recommend you do, or what anybody does on the call, you can have a service connected rating, and you can be receiving compensation monthly and not be enrolled with VHA healthcare. I just want to make that clear. So it's your option. It's at your behest whether or not you enroll, and that starts with um, filing this 1010EZ form. There's a couple ways that you can do it. You can do it online. You can give us a call, or you can do it by mail. But I will say this. There's a couple things that you are going to need if you haven't already enrolled. So get a pen and paper if you're close by to one. If you haven't done so already, there's a couple things that you're going to want to have on hand because there's things that this 1010 easy form is going to ask you. And if you don't have it on hand or you're not good with numbers like myself, you're going to have to come back and make a second trip to us. So the first thing is your discharge papers. So your DD 214 or your member 4 equivalent. Um, If you don't have those, you can still show up. We can look for them. They might be on file with the VBA already. We can look for them. However, it's best that you already have them on file so that we can scan them in for you. If you don't know where to find them, you can go to va.gov /records /get hyphen military hyphen service hyphen records to request a copy of your DD 214. The next thing that you're going to want is your most recent tax return for the last income year. If you have a dependent, somebody like spouse or children outside of yourself, you're going to want their social security number for yourself and your dependents. You want to have that on hand. If you have any current insurance and you have the account numbers or you've got an insurance card, if you can bring that in, we'll scan that in and we'll input that data as well. Also, if you have a VA disability rating decision, aka the service connections that we were talking about, if you have that letter on hand or you recently got awarded that, we'll look at that too. Because if we can input that and potentially upgrade your priority group, we will always give you the highest priority group that you're eligible for. So if you can gather all those things, the checklist, DD-214, tax return, social security numbers, account numbers, and if you have a VA disability rating, if you have all that on hand, you can either go online at va.gov/health-care/apply/application, or you can give us a call. You can call National. The national line is 877-222-8387. And I think they'll ask you for an option. I think you want to select option one. They're open Monday through Friday, 8 a.m. to 8 p.m. Eastern time. So that's a wide range for people that are working late, come back home late. You can still get a hold of them. We close at 4, but you can still get a hold of National. Or you can visit us in person, Dayton VA Medical Center, the Maroon Desk. We're open 8 a.m. to 4 p.m. Weekdays, Monday through Friday. Unless it's a federal holiday, we're closed. Um, or you can print it out online and you can mail the completed form to Dayton Eligibility Enrollment, or you can mail it to the Health Eligibility Center, which is 2957 Claremont Road, Suite 200, Atlanta, Georgia 30329. I'll put that in the chat because I realize I said that quite fast.
And you know
Um,
what? Actually, we actually refer them to the website as well. There's a national website that has all that contact information that we'll be sharing
Wonderful.
down the road too. There's something else I should emphasize here because we hear this a lot in the field talking to veterans that they know that they have a disability rating and they say, well, I think I'm enrolled in healthcare. And the fact of the matter is that they aren't. They've gone to the Veteran Benefit Administration and sought compensation, gotten a disability rating, but they never enrolled in healthcare. Something that I probably should clarify is that the VA is comprised of three components. One is the National Cemetery Administration, the other is the Veteran Benefit Administration, which handles more compensation, and that's where you get your GI loans, education benefits, compensation for military service, etc. The VHA, or Veteran Health Administration, actually is the arm that does the health care. They're not all one organization. You work with one, that's not necessarily meaning you're working with all three at the same time. So if you don't know for a fact that you're enrolled, this is a great opportunity for you to learn more about that and find the contacts to do just exactly that. Next, Rodney had a follow-up question. Since I didn't retire and only served 4 years, is there amount of percentage?
I'm not sure I fully understand that question, Rodney. Um, if you didn't retire, like if you didn't have a pension, I'm assuming you're saying, and you only served 4 years, is the amount a percentage? I'm not sure what you mean. Like if is there a service connected percentage? That wouldn't apply. The length of time you served doesn't necessarily apply to your percentage of service connection, if that's what you're asking.
Okay. Next up we have, and Rodney, we can reach out to you and get you some more details on that and find out what it is specifically you're looking for. Lee is wanting to know, are there benefits useful if you are on Medicare and have TRICARE or secondary coverage?
So, yes, these benefits are useful if you're on Medicare, because if you are eligible and you come and receive these services, uh, the VA is not going to bill Medicare as we mentioned before because we're not going to bill a government insurance. Also, if you have TRICARE, um, what is that? After or right before age 65, I think you need to sign up for Medicare so that you don't lose
It,
your
it goes,
TRICARE.
it goes to TRICARE for life, and basically is in partnership with Medicare. But what I would also say is you still want to explore options through VA healthcare. Never leave anything on the table. I'm an Air Force retiree. I still use the VA. It's got great benefits. There's different advantages and so forth. And while TRICARE is great for community care, you get that same care
Or
here in
better
the health
care.
center, or better care, exactly. You get that care in the hospital, but we can also get community care through the VA as well. And frankly, the copays are usually less for a lot of people. So explore those options.
Yeah.
It's not exactly the same for everybody, but you don't want to ignore those opportunities and ignore those options. So.
Yeah. Thank you, Scott. And he came at it from an angle that I wasn't really thinking of, but my short answer is yes, Lee, absolutely. It's useful because not even looking at it from a Medicare standpoint, if you are eligible and enrolled in VHA healthcare, there are hospitals all across the nation. So if you happen to be traveling or if you're a snowbird, and instead of wondering, oh, which hospital can I find or
Yes.
where do I need to go, there's VHA hospitals all over. So it expands your access to where if you just had Medicare and you were never enrolled, you wouldn't even be able to receive these benefits or have this access. So it just increases your access and the amount of points across the nation that you have the opportunity to receive care.
Okay. Harold wants to know, when should I expect to hear from Camp Lejeune Water Disability? My package has been turned in, but I haven't heard anything yet. Is there a time limit? What about legal commercials? Do I need to contact them? I'll answer that one. First and foremost, you need to go and talk to a VBA representative or a Veteran Service County office, County Veteran Service Office. Those folks, veteran service officers, can actually look up your claims and tell you what the status is. Additionally, I would say this is in line with the recent PACT Act. That we actually have the promise to address comprehensive toxins legislation that the president signed into law this last August, which, oh, by the way, there's a deadline coming up August 9th of this year to get those claims in and get them backdated for when the legislation was actually signed into law. That doesn't mean you can't file a claim after that. It just won't be backdated. It'll be dated from the date that you put the claim in. Again, we highly encourage you to go to a representative of the Veteran Benefit Administration and look up to have any. If you have any concerns about Camp Lejeune or Agent Orange Registry or the PACT Act claims and so forth. Next up, Rodney is asking, is there a place on the website that lists qualifying income for VA benefits? I want to see if I make too much money to qualify. Well, I think we've kind of answered that already, Rodney. And yes, we will be sending you that information on how to get to that website. I'm not certain that it actually has the exact numbers on there, but again, as Bill said, it really depends on where you live as to what that threshold is.
But for the general national threshold, Rodney, I just put it in the chat for you, the hyperlink, the va.gov health benefits, annual income limits, health benefit.
Okay. Lee Whitaker wants to know, are these benefits useful if you are on Medicare and have TRICARE secondary coverage? We already answered that one, I believe. And I believe you've already answered Marilyn's question. What documents do I need to bring for a visit to the maroon desk? If
DD
you want to,
214, tax return, social security numbers for yourself and your dependents, any sort of account numbers for insurance programs you're currently enrolled in, and if you do have a VA disability rating decision, a letter, you can bring that as well. We'll look at all of it.
okay. Next question is, I've been retired from the Air Force since 2003. I deployed multiple times and have no service-connected disabilities. I have deployment or developed issues now and believe they are connected. How do I get reassessed for benefits?
Okay, so I believe Scott touched on this already, but you are ultimately going to want to set up a claim with the VBA for a service connection possible request. And if you've already done so and it was previously denied, you can consider a supplemental claim as well. How does that start? You can reach out with the VBA directly, or you can coordinate with a veteran service officer or VSO. There's one in each respective county in Ohio. Uh, Coincidentally, there's also some here on site at the Dayton VA Medical Center as well. So you can come in and they can assist you on how to file for that. And I'll just reiterate, even though I answered the question from Locker, um, just so everybody's aware, even though I already touched on it in the slides, uh, service-connected disability is something that was either incurred in the service or something that was exacerbated, that is made worse from the service. So it could have been something that you had prior to the service, but potentially during your period of service, uh, while you served, the condition was made worse by your service in the military. So thank you for asking that question so that I could reiterate that.
Yes. Okay. And I'm going to go ahead and touch on the PACT Act again, because you say in your comments that you were deployed multiple times and that you had retired. That service was before 2003. So I'm assuming that if you have issues that have come up just recently after retirement or since, I'm going to encourage you to go to the PACT Act website. That is www.va.gov/pact. www.va.gov/PACT. There you will see a list of military field operations that would qualify you for care under the PACT Act and presumptive conditions. Now, there's a big thing right there. That's a big change in the way VA healthcare was determined before, that you had to have a disability rating that you had to prove was in connection with your service, hence the reason they call it a service-connected disability rating. Now, if you have a presumptive condition and you served in one of those theaters of operations that is listed where you would have been exposed to toxins, and those conditions are varied. It is as I don't want to say as simple as, but it includes things such as hypertension, diabetes, interstitial lung issues, not to mention a whole host of cancers and other other issues that would qualify you, that are now considered presumptive conditions to qualify you for not even just healthcare, but possibly compensation as well through the VBA and healthcare through the VHA. We're going to actually have a PACT Act educational and enrollment fair in Richmond at the American Legion in Richmond on August 5th. We'll also be doing one in Middletown August 26th. You can learn details about those two events on the Dayton VA website. That's www.dayton.va.gov, and click on events, and you'll see those events listed there. You need to pre-register to attend that event so that you can book a time slot. We don't want you coming in when everyone else is coming in. We've got 150 veterans walking through the door and you have to wait in the queue. Go ahead and register. We will have representatives there from Eligibility Enrollment to enroll you with healthcare, along with VBA representatives to help you through the process of filing a PACT Act claim through the VBA. Did I miss anything, Bill? I rambled there quite a bit.
You didn't miss anything. But I was thinking about the initial question from Mary, and I think I briefly touched on it, but I wanted to clarify when she asked basically is there a timeline or a period for enrollment? I told her, that there's really no clear timeline, but we want to get combat veterans in right away. Combat veterans can get 5 years of cost-free health care following separation, and they remain eligible for health care as long as they enroll within 5 years of separation. So, I wanted to make sure that I clarified that, and I also quantified that for combat veterans, there is a 5 year period there. So, regardless of whatever your status or your timeline is, or if you have any questions at all, please contact Dayton VA Eligibility Enrollment. Uh, you can call the main VA line there, and our extension is 5336.
Okay, terrific. Another question I hear quite frequently. Mike is asking, I'm Air Force retired, 60% disabled. How do I change prescriptions to VA from Air Force Pharmacy? And I believe I can answer that one for you, Bill. Actually, you want to go to your primary care physician first and have them, actually, not just your primary care physician, go to primary care, whether it's the physician or the physician assistants or one of the nurses. They can actually help you transfer your prescriptions from the, I'm not even sure what the Air Force is using right now. Express Scripts you might have, or from the pharmacy out at Right Pat, you can have it sent through the VA and have them mailed directly to your home there, or come to the med center and pick the prescriptions up there. I believe also with our clinics as well. Okay. One last thing from Locker. Thank you. I hurt my shoulder while deployed. Now I have limited mobility. So yes, Locker, what you really want to do is go to your primary care physician, talk to them about that. Once you get enrolled, they will be glad to refer you to physical therapy or see what other services we might have to offer. Additionally, yes, that is correct. www.va.gov/PACT is the correct website for the PACT Act. And yes, we really encourage everyone to get that information. I believe that is all the questions we've had for tonight. I've got a couple more minutes. If anyone wants to throw another question in there real quick, I'll be glad to answer whatever we can. And we are running out of time here pretty quick. So we're really hoping you found this event both helpful and informative. I think like I said, we got to everyone's questions, but if there's something that you want to ask us, not to worry. You can call our eligibility and enrollment office at 937-267-7608. You can see the number there on the screen for questions about how to enroll in the Dayton VA. Also, if you have questions about qualifying for the PACT Act, you can also call 937-268-6511, extension 5807, or go to www.va.gov/PACT.
One quick thing, Scott.
Yes.
If you could go a slide back there real quick for us, Greg. Thank you. So The 937-267-7608 number, that's the main line for Dayton VA. If you specifically have a question for eligibility enrollment, you can hit 0, talk to the operator, ask to be transferred to eligibility enrollment, or you can dial 5336. That's eligibility enrollment's extension once you call that main line. I just wanted to clarify that for you guys so that we could
Thanks,
get you
Bill.
taken care of.
We'll update that slide. Didn't know we had the wrong number on there. So yes, again, there are several options for enrolling with the Dayton VA Medical Center. If you're not currently enrolled but would like to enroll with the Dayton VA, here's how you do it. You can come in person as we've said before. You come through that main entrance and you immediately hang a left to go down the hall to the maroon desk. Those folks are very, very helpful. They'll help you any way they can to walk you through the process of getting enrolled. You can also go online to www.choose.va.gov/health. There is a wealth of information about not just how to enroll with VA for healthcare, but just about the many services that we offer. You can also call the National Health and Eligibility Center at 877-222-8387, or you can use the post office, a very reliable way to get a hold of folks, right? Simply print out a 1010 EZ, attach the appropriate paperwork that we talked about before, and mail it to 4100 West 3rd Street, Dayton, Ohio 45428. You can also enroll, or if you have any questions, you can actually go into our community-based outpatient clinics, our VA clinics located in Lima, Middletown, Richmond, and Springfield. You can see their numbers there on the screen. And I don't see any additional questions. So I'm going to say I think we've answered everyone's questions here tonight. So I'm really happy about that. I want to say thanks again to Bill for a great job answering.
Thanks for having me.
It's always a challenge to try to explain the enrollment process to folks. It's not an easy one, but it is worth your time and effort to do so. So again, thanks again a lot. Thanks a lot again, Bill, for all the great information.
Anytime.
And I want to say thanks again to everyone who attended this evening, and let everyone know that we wish you have a great rest of your evening. And thanks to all our veterans for their service to a grateful nation.